Hello everyone. Today we are going to discuss about the very important disease of the horse, that is equine viral rhinopneumonitis. Equine viral rhinopneumonitis is an acute febrile respiratory disease of equines characterized by rhinopharyngitis and tracheobronchitis. The synonyms are equine abortion virus and equine herpes virus infection. If we can talk about its etiology, the disease mainly caused by equine herpes virus 1 and equine herpes virus 4, which are most pathogenic in horse population and cause worldwide transmission. If we can talk about the transmission, it mainly occurs by direct or indirect contact with infectious nasal secretions, aborted fetus, placenta, or placental fluid. The natural reservoir of both equine herpes virus 1 and equine herpes virus 4 is the horse. Latent infection and carrier states are seen with both virus types. If we talk about the clinical signs, the incubation period mainly is up to 2 to 10 days. The common signs observed are the fever, malaise, pharyngitis, cough, inappetence, serous nasal discharge, neutropenia, lymphopenia, and submandibular or retropharyngeal lymphadenopathy. The gross lesions observed are hyperemia, ulceration of the respiratory epithelium, multiple tiny or plum-colored foci in the lungs. Some of the histological lesions observed are the inflammation, necrosis, and intranuclear inclusions of the respiratory epithelium and germinal centers of the associated lymph nodes. Serofibrinous exudate in the alveoli is found. The typical equine herpes virus 1 causes abortion and it occurs 2 to 12 weeks after infection, usually between 7 to 11 months of gestation. No harm to the reproductive tract of mare occurs. It may result into the neurologic disease after some time. If we can talk about its diagnosis can be done through history and clinical sign, the analysis of cerebrospinal fluid, PCR and virus isolation from samples obtained via nasopharyngeal swab and citrated blood sample. The diagnosis of neuropathic equine herpes virus 1 is determined by real-time PCR on samples obtained from nasal secretions, CSF or neural tissue. It can be differentially diagnosed with equine influenza and equine viral arthritis. There is no specific treatment for equine herpes virus infection. Only supportive medication can be provided through rest and nursing care, antipyretics to control the fever, antibiotic therapy for suspicion of secondary bacterial infection. One of the antiviral drug, valacyclovir, at the dose rate of 30 mg per kg per orally twice in a day, given to prevent the neurological signs. For the control measures, isolation of new horse for first 20 days before introduction into the herd, stress management, disinfection, strict sanitation, and vaccination. So the first dose given at the age of 4 to 6 months, second dose on 4 to 6 weeks after the first one, and third dose at 10 to 12 months of age. Booster vaccination at every 6 months will be given up to the maturity. Modified live vaccines are also available.
Please like, comment and subscribe to my channel.